Welcome to this video. In this video, I'm going to show you how to re-engage a distracted breastfeeding baby and provide expert tips for keeping your little one focused on the task at hand. 1. What are some signs that a baby is distracted while breastfeeding? Signs that a baby is distracted while breastfeeding can include fussing or pulling away from the breast, turning their head away from the breast, showing signs of restlessness or disinterest in feeding, biting down on the nipple, and poor latching. Some babies may even start to cry during feedings if they become too distracted. If these behaviors persist for more than a few minutes at a time, it could be an indication that your baby is no longer interested in breastfeeding or needs help to re-engage with the process. 2. How can I re-engage my baby when they become distracted? There are several strategies you can try to help re-engage your baby. Talk softly and gently stroke their forehead or back. This can provide a calming effect and make them more relaxed, allowing them to refocus on feeding. Move the breast around in their mouth to encourage them to latch on again. Change your position and take breaks if needed. If your baby is having trouble focusing, sitting in an upright position or changing positions, such as leaning over a pillow, may be helpful in getting them back into a comfortable breastfeeding groove. Similarly, taking frequent breaks for burping or diaper changes can help keep your baby interested and engaged in the process. Offer skin-to-skin contact. Skin-to-skin contact can provide a sense of comfort and security, which may help your baby to re-engage in feeding. Avoid distractions. Try to minimize other stimuli that could be distracting your baby from breastfeeding, such as loud noises, bright lights, or other people talking nearby. Use music or white noise. Soft music or white noise can also be soothing for babies and help them to relax and focus on the task at hand, breastfeeding. 3. Are there any tips to help keep my baby focused during feeding times? Yes, here are some tips to help keep your baby focused during feeding times. Make sure you're in a comfortable, relaxed environment. This may mean dimming the lights or turning off electronics and other distractions. Talk softly to your baby while they're eating, or sing soothing songs together. If possible, try skin-to-skin contact with your baby. The physical closeness can be calming and help them focus on breastfeeding. Try different positions for breastfeeding, such as side lying or cradle holds. This will help keep your baby interested in continuing to feed. Experiment with different breast milk tastes by adding flavorings like vanilla extract or natural fruit juice. This will help make breastfeeding more interesting for your baby and give them a reason to keep nursing. Use a breast pump or hand express milk between feedings to increase stimulation and promote milk production for future feeds. If you're feeling overwhelmed or anxious, take a few moments to gather yourself before beginning the feeding session. This can help you stay focused on the task at hand, providing nourishment and comfort to your baby. 4. Does distraction at feeding time mean that the baby is not getting enough milk? It is possible that a baby who appears to be distracted during breastfeeding may not be getting enough milk. If the baby seems to be consistently distracted during feedings, it would be advisable to talk with your healthcare provider in order to determine if this is an issue. It is also important to keep an eye on the diaper output of your baby in order to ensure they are getting enough fluids and nutrition. If the newborn isn't wetting at least 6 to 8 diapers per day and producing several bowel movements, then there may be a concern about their intake or absorption of breast milk. Additionally, if the mother notices that her breasts no longer feel full after feedings, or she notices reduced wet or dirty diapers, these can all indicate insufficient intake as well. 5. What should I do if my baby continues to be distracted and refuses to nurse? If your baby continues to refuse the breast, there are a few things you can try. The first is to change your environment. Look for a calmer and quieter spot away from any noise or distraction. You can also try different positions, such as skin-to-skin contact, which helps create a calming effect and breathes life into an otherwise stale nursing experience. If this does not work, it could be helpful to express milk for them either manually or with a pump if they are having latching issues that make it difficult for them to nurse directly from the breast. Offering express milk in an alternate way may help re-engage your baby's interest in feeding. 6. Is it possible for me to avoid distractions in the first place and keep my little one focused on nursing? Yes. There are a few things you can do to help prevent distractions while breastfeeding. First, find a quiet place without any distractions, such as phones or TVs. If that's not possible, try using white noise like a fan or air conditioning unit to block out other sounds. Also, ensure that your baby is well fed and adequately rested before nursing so they don't become distracted easily due to hunger or tiredness. Finally, make sure the room temperature is comfortable for both you and your baby if it's too hot or too cold. This could be a distraction as well. With these tips in mind, you should be able to maintain a distraction-free environment for successful breastfeeding sessions with your little one. 7. Are there any strategies I can use to make sure breastfeeding stays enjoyable for both of us? Yes, there are a few strategies you can use to make sure breastfeeding stays enjoyable for both of you. First, make sure that your baby is comfortable during feeding time. Ensure that the room is not overly hot or cold, and adjust their clothing as needed so they feel secure and comfortable. Second, try different positions when nursing. This will help keep things interesting while also helping your baby to latch properly. Third, make sure the environment is calming and distraction-free. Play calming music or soft sounds if possible. Dim any lights in the area if there are any, and turn off any other distractions like TVs or radios. Finally, incorporate skin-to-skin contact whenever possible by holding your baby close and snuggling them during feedings. This will help create a calming bond between the two of you that will make breastfeeding more enjoyable for both of you. We hope these expert tips have helped you understand how to re-engage a distracted breastfeeding baby. Remember, it's all about creating an environment that is comfortable and calming for both mom and baby so that the experience can be enjoyable for everyone involved. If you found this video helpful or if you have any questions, please leave us a comment below. Also, don't forget to hit subscribe so you don't miss out on any future videos from our channel. Thanks again for watching. We'll see you next time.